So today we're announcing a new paid sick leave program. It allows for workers to qualify for up to 4 paid sick days, and this is to complement that federal program. We want employees to stay home if they're feeling unwell and follow public health protocols to help reduce the spread of COVID-19. People who cannot work remotely and miss less than 50% of their scheduled work in 1 week period due to COVID will be eligible. This includes Nova Scotians that are waiting for their PCR test results, if they're getting tested, self-isolating while waiting, or getting their vaccine. The new program covers employee wages, including those of self-employed people, and that's up to a maximum of $20 an hour or $160 per day. The maximum payment is over a 12-week period is $640. The employer can now continue to pay their employees and then will be reimbursed under this program. If the individual does test positive for COVID and they have to self-isolate for 14 days, there are other programs that they're eligible for, both provincially and federally. On the vaccine front, this program, our restrictions and of course getting everyone vaccinated are part of a suite of measures that will help stop the spread and protect us from the virus. So this has been a topic of federal discussion, and they've extended their Canada Sick Benefit program. You're eligible for their program if you miss at least 50% of your work week. So there's a gap of if someone is symptomatic and they think they may miss just 2 or 3 days. I think that some of them may take a risk and go to work for financial reasons. So we want to eliminate that as a possibility to prevent any spread in some of these workplaces. So we have been looking at this for months now, as other provinces have. I think you've seen other provinces come out with similar programs. This is one is based on a scan of other programs to ensure that there is that opportunity for those that are missing 4 sick days, that they have that eligibility, and it's paid by the government, not the businesses. There continues to be some concern around AstraZeneca. A number of provinces have already chosen to take a pause on this vaccine. It's difficult for me to think of saying no to any vaccine, but my goal as your Premier is to get everyone immunized as quickly as possible. Nova Scotians are deciding on their own to choose the mRNA vaccine before AstraZeneca now, since we've dropped the age cohort down to 40 and up. More and more Nova Scotians are cancelling their AstraZeneca appointment and choosing the mRNA vaccine. Over 1,000 appointments have been cancelled, and our health providers are telling us that most people are choosing the mRNA. There is a global study underway to determine if an individual who took their first dose of AstraZeneca can mix their second dose with either Pfizer or Moderna. That is an important piece of science that we're awaiting. And until that study is complete, we are putting a pause on the AstraZeneca vaccine. This will not take us off course, to be clear. Our vaccine program continues to roll out on schedule. And it's my hope that we'll continue down this path to get everyone a shot of vaccine in the month of June. But Dr. Strang and I do want to accept a vaccine that has no potential of being wasted, and that's why we're pausing that today until further notice.
The decision to pause the use of AstraZeneca is based on caution, science, and the availability of alternative mRNA vaccines from Pfizer and Moderna. With a national and global concern around the serious side effect VIT, it is the best solution to move people who were to get AstraZeneca to receive mRNA vaccine instead, because their age eligibility completely overlaps. As we move these bookings to Pfizer and Moderna as soon as possible, I ask for patience for those who will have their appointments canceled and then rebooked. You will get vaccinated soon. We've always in Nova Scotia taken that people may have a choice on vaccine products, but we've made sure that they have an informed consent about the various risks and benefits of the different vaccine products, and we've been very clear that AstraZeneca has some unique risks to it, and made sure Nova Scotians were given that information, allowed to make a choice. What we're at now at a position now, we're saying that because we now have mRNA vaccine into the 40-plus age groups, it doesn't make sense to continue to offer the AstraZeneca vaccine because the mRNA vaccines don't have the same safety signal.